Assessment for change in echocardiographic left ventricular global longitudinal strain pattern following a transcatheter aortic valve replacement by Lakshmi Rao, Akarsh Parekh, Anila Rao, Melissa Ainatelli, and Mark Zania. Our objective in the study was to evaluate global longitudinal strain, or GLS, in transcatheter aortic valve replacement patients, or as known as TAVR patients, comparing pre-TAVR echocardiogram to post-TAVR serial echocardiograms at 1 day and 30 days. A little background. Aortic valve replacement is indicated, as we know, for patients with symptomatic severe aortic stenosis or in the setting of echocardiographic evidence in decline of left ventricular function. As outlined in our most recent guidelines, transthoracic echocardiogram is the recommended initial diagnostic test in the evaluation of patients with known or suspected valvular heart disease. Global longitudinal strain is a known echocardiographic parameter that is relatively newer and underutilized despite its ability to predict at-risk myocardium. In regards to utilization of GLS in the setting of valvular heart disease in patients with severe aortic stenosis, currently today there is limited literature available to show utilization of pre-TAVR GLS evaluation or serial echocardiographic monitoring to demonstrate improvement of GLS in post-TAVR studies. How we constructed our study is that we performed a retrospective study in a single-center community hospital on patients with severe aortic stenosis who received transcatheter aortic valve replacement. The study period was from November 2019 to July 2021. All patients receiving a TAVR were included in the study. The only exclusion criteria was the absence of a pre-TAVR transthoracic echocardiogram having GLS. A 2D transthoracic echocardiogram was performed prior to TAVR, then at 1 day post-TAVR, and 30 days post-TAVR implantation. The outcomes of TAVR on global longitudinal strain were observed in relation to other echocardiographic factors, including left ventricular ejection fraction, E to E prime, E to A ratio, and assessment of the aortic valve functionality. As you can see, the results in our table here, there were 18 patients that met the inclusion criteria. After TAVR implantation, the valve gradients and area significantly improved. As you can see, left ventricular ejection fraction had a statistically significant increase from 58.6% to 63% at 24 hours post-TAVR. There was a notable but not statistically significant increase in left ventricular ejection fraction at 30 days, in which overall the ejection fraction went from 58.6% at baseline pre-TAVR to 60.3% at 30 days post-TAVR implantation. The global longitudinal strain did not show a statistically significant change at 1 day, going from negative 15.2% at baseline pre-TAVR implantation to negative 16.8% post-TAVR implantation at 1 day, then at 30 days going to negative 15.9% post-TAVR. In conclusion from our study, we note that more studies are needed to be performed utilizing global longitudinal strain in echocardiographic evaluation pre- and post-TAVR to assess the clinical utility of global longitudinal strain in these patients. We found that an improvement in global longitudinal strain was not statistically significant in our TAVR study population at 1-day and 30-day evaluation. Risk stratification of patients' GLS during their pre-TAVR assessment should be utilized. Tracking the progression simultaneously with ejection fraction through 30 days and further should also be considered. Thank you.